A surgeon removes tissue from the wrong breast during a breast cancer operation. At another hospital, a patient dies from infection after a doctor leaves a surgical towel in his stomach. And a newborn dies after hospital staff failed to monitor and control sugar levels in the baby's blood. Just a few of thousands of mistakes made at California hospitals since 2010.
And our area is not immune from the dangerous and sometimes even deadly errors. News 10 investigative reporter Tom Jensen put every hospital in a 13-county area under the microscope.
I can tell you this assignment was a challenge. The California Department of Public Health does not make it very easy to see the health of your local hospitals. But we obtained the records, and after watching this report, we'll show you how with just a click of the mouse, you can compare hospitals before you or a loved one checks in. In 2011, 64-year-old retired firefighter Tyrone Lee walked into Memorial Medical Center in Modesto for a common procedure. He needed gallstones removed.
He was just going in for, minor surgery.
His brother, a retired homicide detective, expected Tyrone to be home in just a few short hours. But he didn't hear a word until later that night when his family called.
My older brother had called me and said, hey, Tyrone's in the hospital, in intensive care, he's brain dead.
What happened to Tyrone is documented in this report from the California Department of Public Health. 8 bladder stones were removed after an uncomplicated surgery. Post-op, during a gurney ride back to his recovery room, 3 workers held Tyrone in place because he was thrashing. He was given the drug propofol to calm him. Tyrone stopped breathing 60 seconds later.
Well, you go in for a simple operation, all of a sudden you're brain dead. What happened?
In Tyrone's case, the state says, he was not breathing and without oxygen for approximately 17 minutes. The records show that no one called a code blue, an urgent alert to hospital staff that a patient needs immediate resuscitation. A career malpractice attorney filed this lawsuit on behalf of the Lee family.
The nurse screamed at the doctor 3 times, according to the report, do you want a code blue? Do you want a code blue? Do you want a code blue? And a code blue was never called.
11 days later, Tyrone was pronounced dead. His family claims if someone would have just looked at his medical chart, they would have seen Tyrone has sleep apnea. And in order to keep his airway open and breathe, he needed to be upright, not on his back.
It was just a matter of that he didn't read the charts. And that's
something so simple.
Yeah, very simple. Read the charts and you'll know that, he's got to be, almost straight up.
Sutter Health owns Memorial Medical Center. They wouldn't talk to us about this case or the hospital's overall record with the state. In an email, a spokesperson wrote this about the Modesto Hospital. We will continue to focus on our safety practices and train rigorously to make sure we provide our patients with safe, quality, affordable care. Another state report on Rideout Memorial Hospital in Marysville. In September 2011, 2 nurses state that a patient is being admitted with right hip pain and needs surgery to repair a fracture. During surgery, after her right hip was already opened up, the surgeon discovers he was supposed to be operating on the left hip.
I figured eventually they were going to get caught sooner or later.
This nurse resigned from Rideout last year because of what she described as a pressure cooker where nurses have so many patients they sometimes have to cut corners to get their work done. She agreed to do an interview with us if we concealed her face, changed her voice, and kept her name secret.
There's been plenty of times where you see the mix-ups. And I get it, it's human nature, we all make mistakes, but when someone's life is in your hands, you definitely need to be a little more thorough.
Rideout agreed to do an interview with us to talk about all of these issues. But the night before the interview, the new CEO backed out. Why? Because we dared to contact current and former employees to ask them about the health code violations here. In a written statement, Rideout's interim CEO said, we are no longer looking back on earlier deficiencies, but moving Rideout forward to providing high-quality patient care. Over the past 4+ years, the California Department of Public Health has substantiated 115 patient care incidents at Rideout. Memorial Medical Center in Modesto has even more, 154. Our research found more than 1,000 incidents at the hospitals in our area where patient safety was an issue.
It shakes me to the core, and it shakes others, and it shakes the public to the core. We're entitled, as members of the consumer public, to trust our doctors.
As for its part, the California Department of Public Health refused to sit down with us and do an interview. Even after we gave them a 2-month window and told them to pick the day and time, a department spokesperson said no one would be available. Back to you.
Well, we've told you about some of the problems, but it's not all bad. Kaiser Hospitals, UCD Med Center, and Dignity Health Hospitals fared much better. Sutter Hospital in downtown Sacramento also scored well and had no fines over the past 5 years. So what about your hospital? Well, we put an interactive map on news10.net. You can click on every hospital and see how they fared in this area of care.